On today's episode, we are talking about this week's major update to the HIPAA Privacy Rule, a change that strengthens privacy protections in reproductive health care. Now, this new rule makes it clear that protected health information, or PHI, cannot be used or disclosed to investigate or impose liability on anyone seeking, providing, or assisting with lawful reproductive care. Basically, it closes a loophole that could turn private medical decisions into public legal battles. Now, why is this such a big deal? Well, imagine this. A patient crosses state lines to access care that's completely legal where they are. Their health records could then be fair game for someone looking to attack them later. That fear has become very real for many patients and providers, and this rule is designed to stop that scenario, building a wall around reproductive health information so that it stays between patients and their trusted healthcare providers. One of the key changes is a new requirement for healthcare organizations. If a request for PHI might involve reproductive health care, the requester has to sign an attestation, a formal statement saying the information isn't being sought for prohibited reasons. No attestation, no information. This creates an extra layer of accountability and ensures healthcare providers aren't put in the uncomfortable position of having to decide what is legitimate and what is not. Another big update here, organizations must revise their Notice of Privacy Practices. That's the document patients usually skim and sign without much thought, but now it will explicitly spell out these new protections, so patients can know that their privacy is being taken seriously. This is a small change, but it's going to make a big impact on trust. Now let's talk about some of the ripple effects this new rule is going to have. First, for healthcare organizations, it means getting your house in order. Policies need to reflect this rule. Training programs need updates so that every team member from the front desk to your compliance officer understands the new requirements. And any process for handling PHI requests needs to be airtight. For patients, this is a step toward restoring confidence. When people know their information is safe, they're more likely to seek the care they need without hesitation. And for providers, it means one less worry. Knowing your work to provide lawful care won't lead to your patient's privacy being violated, or your own, helps create a better environment for everyone involved. Now, the timeline for this is now. Healthcare organizations were told that they had to be in compliance by December 23rd, 2024. Now, organizations need to review their policies, update processes, and ensure that their teams are trained on these new standards. To help with this transition, the Office for Civil Rights has made several resources available. These include some detailed guidance documents and even videos on their website and their YouTube channel. If you're feeling overwhelmed or unsure where to start, these resources can provide a clear path forward, outlining exactly what's expected under the new rule. So what's next for you? Start by reviewing your policies and procedures. Make sure your Notice of Privacy Practices is updated and ready to go. And don't forget staff training. This is one of those areas where everyone needs to be on the same page. Internal audits can be a lifesaver, catching any gaps before they become compliance issues. And this rule is a reminder of a larger truth. Privacy is the foundation of trust in healthcare. When patients feel confident that their information is secure, they can focus on what really matters, which is their health. And when organizations build that trust, they strengthen their reputation and their relationships with the people they serve. Now, for healthcare leaders, compliance officers, and administrators, this is your moment to double down on privacy protections. Use this rule not just to meet the minimum legal standard, but to raise the bar for how privacy is handled in your organization. Now that wraps up today's discussion. Thank you for tuning in. As always, we will keep bringing you the latest insights to help navigate this changing landscape of healthcare privacy and compliance. And if you need any help or have any questions, please reach out to our team at any time. We're here to help. Until next time, stay informed and keep prioritizing privacy.